You're watching Randy Alvarez Marketing Report. I'm Randy Alvarez. With us, we have Dr. David Hornbrook. He is, for those of you non-dentists that watch my marketing report, he is really one of the pioneers of cosmetic dentistry. I don't think anybody would dispute that. He's well known all over the world. He speaks to thousands of dentists at one time, talking about bite and talking about cosmetic dentistry and the new materials, et cetera, et cetera. And that's really the speech. I think any dentist watching this knows who you are. So I want to welcome you to our marketing
thank you.
report.
I appreciate it. One
One of the things, and plastic surgeons are guilty of this, dermatologists, is they don't give patients all of their options. They may prejudge them, or they don't give their best advice, or they let the patient make a mistake, possibly. And so let's talk about this. This is one of your pet peeves.
It is, and you mentioned plastic surgeons, which I think are a little different than dentistry. People go to a plastic surgeon thinking they're doing something to improve their appearance. Where dentistry may be they're going in because they have a toothache, or they have a swelling, or they have a filling that broke. And so they're coming in with what I call need dentistry. I think it's our obligation, especially the way dentistry's changed, to let them know what we can do in terms of want dentistry. Whether it be whitening, whether it be metal-free, whether it be just changing someone's self-image or life with a beautiful smile. Our patients need to understand what we can offer them today.
But tell me this, because look, I already know the science nerdy guy, and they have plastic surgeons like this too. They go, but Randy, somebody comes in for Botox, and I know they'd benefit from a neck lift or jowls or brow lift. I don't want to upset them. Because dentists will say the same thing. I don't want to look like I'm selling something. So what advice do you give to these people
Let me
so
tell
they feel comfortable doing it?
Yeah, and this is what I teach the doctors I work with my hands-on program. This is what I do in my own office. So let's say you came in, and the first thing you said was, I don't like this one crown. It's got a chip or whatever, front tooth. I'm not going to say, and again, this is what general dentists do because I've worked with thousands of them. They would say, I can fix that. All right, end of story. The way I would handle it, I would hand you a mirror. I would say, okay, Randy, if we fix that chip or replace that one crown, are you going to look in the mirror and say, I love my smile? And you say, well, I wish they were whiter. Okay, now the treatment plan just changed. I didn't tell you that they weren't white. You made your own treatment plan. So now it's whitening, and then we'll match to the whitened teeth. So I would say, okay, if we replace that crown or fix that chip, and your teeth were whiter, would you look in the mirror and say, I love my smile? Maybe you'll say yes, or typically what they'll say is, well, I wish they were a little longer. Okay, the treatment plan just changed. I didn't tell you they were short.
This is very nice, what you're saying, because a plastic surgeon, dermatologist watching this, they're coming in for one thing, and the typical doctor will say, okay, we'll take care of that, those jowls. But they say, well, let's take a look. Tell me what else.
And I think it's important.
Because this applies to anything across the board.
Oh, absolutely it does. And I think that we don't need to say, like a plastic surgeon say, I know your eyes are sagging. What do you think about your jowls, or are your ears too far out? All of a sudden you're planning things. You're saying, you know what, your ears are a little too far. I can help you out with that. I don't want to say that. I want you to make the diagnosis. So now all of a sudden you say you need that chip fixed. You want your teeth whiter, and you wish they were longer. All right, now I'm going to explain the options that we can go from there, whether it be direct bonding, whether it be veneers, whatever it is.
Let them self-diagnose.
Absolutely.
By just asking them what else you don't like? Is that what you say?
Absolutely.
What's the word track on that?
Well, I say if you looked in the mirror, would you say, I love my smile? I have a great smile. And sometimes it's just fixing the chip.
So you could say that, if you looked in the mirror and said, I love my face. I mean, you could...
Oh, for a plastic, yeah. If you looked in the mirror and my eyes, I didn't have these little swollen areas here. Would I look in the mirror and say, you know what, I like the way I look today?
They say, no, I don't like my nasal labial folds.
Yeah, I wish these weren't here. Okay,
my neck, I can't see.
So if we put some fillers in here, we fixed your eyes, you look in the mirror, you're going to say, I like the way I look. Well, how about this?
And they
right
don't
here?
do it? Is that really a problem in dentistry? Because I know it is in the other.
No, they don't. They would fix your chip. That's the way they do it.
One of the things I said about you before you came in, and it was a lesson here at the Wellness Hour. One of the doctors aired at 5 p.m., which I hate 5 p.m. You're competing with the news. Nobody has ever succeeded at 5 p.m. And I said, next time that happens, call me. I don't care if it's the middle of the night, because I go, Dr. David Hornbrook is like this too. He doesn't want to let a patient make a mistake. I don't want to let a doctor make a mistake. He's paying this money for half hour. And I said, and I would have told him, give your money to charity. Don't run at that time. And if he decides and overrules me, that's fine. But then when it doesn't work and he calls me, because the impression is, I tried that and it didn't work. No, you ran it at the wrong time against what we did. And because Nicole is so nice, I mean, she tried her best, but I think she gave up too soon. I wouldn't give up. I don't want to let him make a mistake. Do you think that dentist, because I know, let patients self-diagnose too much without the doctor? Like they come in, I only want 2 front veneers.
Yeah, I think we need to plant seeds. And again, the way we'd handle that is, well, I don't like the space between my 2 front teeth. I want that closed. We can do veneers. Again, I would say, well, how do you feel about the rest of your smile? How do you feel about the shape of those? Well, they're 2-pointer, they're shorter. I don't like this chip.
You get them to admit it.
Absolutely. And I think that your point with your commercial was excellent, because when you talk to him, that whole investment that he made was not about you, it was about him. Why? If it aired, he still paid you. You're still going to get paid. But he's not going to get the benefits that you really wanted him to get. So instantly when you heard about that, it was about him.
Yeah, and when they fight us a little bit.
Yeah.
But I wouldn't have given up.
Yeah, because it was about your doc. It wasn't about you.
Yeah.
And when I sit with my patients, it's not about me. If I think, he just needs that chip fixed. Who am I to judge? Maybe you want whiter teeth. Maybe one time in your life you'd like whiter teeth.
All right.
Maybe if you're going to have that space closed, maybe that's one time in your life that you wish you had a great smile. You now have decided you're going to spend some money on your teeth. Sometimes I get chastised from clinicians that say, that woman's 70 years old. Why'd you make her teeth so white? Because she wanted them.
Okay.
Right? Because she needs it, whether it be a bite issue.
Couldn't somebody say that that's a mistake too? Now it made the gums look darker.
Well, but the thing is when she looks in the mirror and she likes her smile,
okay,
that's not my smile anymore.
That's a good one.
Now,
good point.
I can say, Dorothy, you're 85 years old, and typically women that aren't 85 aren't going to have this bright white teeth. It'll look like a denture, and you have all your teeth, and you should be proud of that. Why don't we just make them look like a beautiful smile, but very natural, a little more natural? And I have patients that, you know what? I have never invested money into my teeth other than a couple crowns, every couple of years. If I'm going to invest this $10,000, $15,000, $20,000, this is a time in my life that I want them to be bright white. And who am I to say that's not going to work?
Okay.
We do this with plastic surgeons, right? We've all done this you look at the Joan Rivers syndrome, where you look and say, that person has had way too much plastic surgery. That person is trying to look 30 when they're 75.
All right.
But at the same time, they look in the mirror and they like the way they look.
So if it's a boost in their self-esteem, that's fine.
Absolutely.
This is a new perspective. One last thing for the marketing report, and that is that I speak at the American Academy of Anti-Aging Medicine with integrative medicine docs, and I speak to the American Academy of Facial Plastic Surgeons, and I also believe that doctors need to give a bit of a mental expectancy, like a placebo effect. And so my feeling is that not enough doctors create this future of being better off. You, on the phone, which I heard about you for 12 years, right, and I thought, makes this guy so successful? What makes him tick? And sure enough, you said that you tell them when you look in the mirror, elaborate on that. Right. And do you think that that's another thing that dentists don't do enough of, which is painting this picture of what's going to happen when it's all done?
Oh, absolutely. Yeah,
what do you say? Tell them what you say.
Well,
I love this.
And these are patients that are realizing, they look in the mirror and they say they wish they had a nicer smile now, right? So as we look to the future, even if it's whiter or longer teeth, who's to say that they're not going to have Restylane or surgery in the future?
But I think that my point is that when you told me on the phone that you tell them it's expensive, but when you look in the mirror, and you could finish this, what do you tell them?
Right. I tell them when they look in the mirror, when we're done, they're going to wish that they had made this investment 5 years before. And that's the future. You think about decisions you make today, right? People work out today so they may meet a mate, or they may stay healthy so they'll have a better life 5 or 10 years down the road. We make decisions, especially in appearance and health-related decisions, on the future. And I think a lot of dentists don't think about that. They don't think about that if I change this person's smile, and plastic surgeons the same thing, or dermatologists. Yeah. If we don't offer this patient an opportunity to change their self-image, it could affect their life 5 years from now, 10 years from now, 15 years from now.
Interesting. So the biggest mistake doctors make in presenting to patients is the lack of presentation, maybe.
Yeah, they treatment plan for themselves.
They do it based on what they think would be good.
Yes, absolutely.
They don't dig enough for the motives of the patient?
Absolutely. Yeah, that's huge. I think, and that's across the board, whether it be plastic surgeons, dermatologists, dentists.
In positive influence, in motivational psychology, they say in order to influence anyone to do anything, you have to find out what drives them, what motivates them. And I think that too many doctors on a superficial level, they just know, oh, you came in for this. You came in for that. Oh, it says you want this.
Yeah.
But you dig deeper.
Absolutely.
You think that's what makes you a little better? You dig
I'm
deeper
not gonna
for
say
motivations?
Better. I think that,
well, no, you could say it.
that I think that's why I get better treatment acceptance, is because I found problems that the patient didn't share with me on that piece of paper.
Okay.
And also, I've planted seeds. You know, I think
From
that
the second they walk in the door,
Oh,
you
yeah.
say you plant seeds.
we plant seeds.
What does that mean?
Well, you look in our office, and it could be a plastic surgeon, it could be a dermatologist, it could be a hair salon. There's something going on. It's not about, you know, pictures of the Grand Canyon on my wall or a picture of a beautiful lake. It's about the health industry and looking good.
And smiling.
You know, yeah, absolutely. Or looking good.
Okay.
You know, you think about you going to a high-end hair salon. What do you look around? You don't see a bunch of before and afters. You don't see pictures of boats and cars. You see attractive people that you just want to kind of be like them. I mean, you may never be
So
like them.
that's what you have planned in your office.
Absolutely.
Because I've been there. I mean,
absolutely.
you've got testimonials going,
Absolutely. I want people
catalogs right there.
in my before and after books, testimonials. Anytime I have a smile or do any dentistry for someone that says, "Wow, this is awesome. I love being here," I say, "Could you, when you go back to your office or you go home, can you write a little note on your personal stationery and send it to me about your experience?" That goes in a book in my reception area. That's what I want my patients to read, not Reader's Digest. Patients
Okay.
want to be associated
Aren't
with a
all
doctor.
dentists doing this?
No, everyone has Reader's Digest, People magazine, and they have pictures of the Grand Canyon or
Now, you have a
some
lot
ocean.
of photos, by the way. You know what I hear when they come in here? Randy, you don't know. People don't want to give their photos.
I totally disagree. By taking these photos, what I'm saying is, you know what? I like what we did here. You look great and you should be proud of it. And that in itself.
So that's no excuse where, oh, you don't know.
no.
Because I hear it, by the way, because I meet, you know, it's so funny. There's a one-to-one relationship. The most successful guys in all the industries have great photos.
No.
They have an ability, but also you do great work. You know, we should mention, because I get to infiltrate the most successful practices in the country. And I'm the marketing guy that says, if you're not busy, you probably have something to do with it. It's not the economy.
Yeah.
So second to the fact that you've got more photos, you also do great work.
Well, I think that's the first.
that's-
That's the first obligation, right?
So they gotta become excellent
We have to
also at what
we have
they
to
do.
be educated. We have to be excellent, and you have to be. You have to feel you're great.
You have to feel deep in there.
Absolutely.
Okay,
Otherwise,
good.
I mean, how can you know? If I think I can offer you a gift by changing your smile, but I don't think I can deliver, how can I consciously?
It's not gonna
try
transfer.
to create value, and you know your team members. You know my team members, my staff, they're trying to treatment plan as much dentistry as possible because they know the quality of work I can deliver. And too many times I'll see people at conventions, they'll be staff members. They'll say, "God, I wish you could do my veneers," but it's like, what? If you wouldn't have
And they
your
work
own,
for the doctor.
Yes. If you wouldn't have your own doctor do your surgery or your teeth,
You say it's easy for you to create value because
because it's about the patient, it's not about me.
but also because you say you feel like you're giving them a gift.
Oh, I am giving
Like you
them
feel like you're doing a favor.
Yes,
them.
absolutely I do. Maybe not so much a favor as I
it's
think
a
I'm
good-
giving them an opportunity
I feel that way
to
too.
be different.
I feel that way too. I feel like, you know, and I tell my staff, I go, look, they don't get it. It's not their fault. But I'm convinced that if they do business with me, they're so much better off than if they don't. And you feel that way too.
Absolutely.
It's like we're in the transformation business.
But you know, in the fast-moving train to paradise that I talk about, you know that the reason why you think you're giving them a gift because you know the successes they'll have because
point.
you've seen that.
Yes.
You could lay out all these docs and say, look what this doc did, look what this doc did, look what this doc did.
Good point.
And I can say, look what I did with this patient, this patient, this patient. They can't see that yet.
That's why we're going to have to hang out after this and just brag about ourselves till
I
like
don't know
2
about
in the
you.
morning after a couple
How about you
glasses
brag
of
about me? I'll brag about you.
Exactly. I want to thank you for coming
All right,
on
my
this
pleasure.
marketing report.
It's
Good
been
stuff.
awesome. Thanks.
Pleasure to meet
I
you.
enjoy
by the
spending
way.
time with you.
Good,
Yeah.
and you lived up to. You exceeded my expectations
Thanks, I
after hearing
appreciate
about
that.
you for 12 years.
Unless your expectations were really low.
No, they were already way up
Okay,
high.
good. I appreciate that.
So that's this week's report. We'll see you next week.